Hi, I'm Dr. Harry Derr from Living Wellness. Today I want to speak with you about the opioid epidemic and rethinking our approach to pain. The wrong type of pain management can wreak havoc on your recovery and your life. That, paired with the surging epidemic of prescription opioid overuse that has left a dramatic effect on thousands of people in the U.S., should have you thinking twice about opioids for pain management. In fact, the Center for Disease Control, also known as the CDC, says that about 1 in 4 patients who receive prescription opioids long-term and not for cancer-related pain are going to struggle with addiction. About 1,000 people are treated in the ER every day for misusing these prescriptions. In fact, since 1999, deaths involving opioids in the U.S. is over 218,000. And further, according to the CDC, 130 Americans die each day from overdosing on opioid drugs. But prescription drugs aren't just bad because of the addiction and death toll, they're also harmful to patients when it comes to healing. Opioids tend to numb the pain and worsen the musculoskeletal condition. Often patients feel better when they're not actually healed, which can cause serious damage to their already injured bodies. Even worse, the CDC estimates the total economic burden of prescription opioid misuse in the U.S. is $78.5 billion a year, including the costs of health care, lost productivity, addiction treatment, and criminal justice involvement. There's a fast-growing study that suggests that chiropractic services are a valid, drug-free way to handle pain. In fact, the American College of Physicians updated its guidelines for the treatment of acute and chronic low back pain in 2017. What is the update that they added? To recommend non-drug and non-invasive treatments before prescribing drugs, including such things as chiropractic treatment. Further, the ACP's guidelines, which are published in the Annals of Internal Medicine, say that therapies like heat, massage, spinal manipulation, and acupuncture are some of the greatest alternatives to drug therapy for low back pain. They included a caveat. If these treatments don't help, a patient should move on to medicines, only resorting to opioids if absolutely necessary and if prescribed by a doctor. In fact, it's said that opioids should only be prescribed when the actual pain outweighs the real potential for addiction. The CDC even released guidelines in 2016 for prescribing opioids in terms of treating chronic pain, and in 2015, the Joint Commission, the organization that accredits more than 20,000 healthcare systems in the U.S., recognized the value of non-drug approaches by adding chiropractic and acupuncture to its pain management standard. Patients are encouraged by the American Chiropractic Association to try out everything they can for pain management before moving on to dangerous and risky opioid treatments. They care so much that they even met with delegates in Washington, D.C. in 2016 and adopted a policy statement proposing a solution to the dual public health concerns of inadequate pain management and opioid abuse. Thanks for watching. I welcome any comments or questions at the bottom. I look forward to hearing from you. Please share this video so that others can hear our message.